Well, it's really good to be back doing podcast team brief. And to celebrate the first podcast of 2014, we're at the Hanover Building at Leigh, the week after it was officially opened by Andy Burnham MP. So team brief is going to come from various parts of the building, and then at the end I'm going to meet the very well-known Mike Watson, our corporate project manager, and amongst other things I'm going to be asking him 3 questions. First of all, how many scopes do we decontaminate in this building every week? Secondly, of the new fascia on the outside, how many tiles are there? And thirdly, who is the doctor that works in this building that conducted a caesarean section on a cow whilst on holiday? This month's corporate objective is the leadership one, and we've had a huge amount of activities. We've got a new internal course with 30 senior managers and clinicians on it, where we'll be having a second wave soon. We've started a new ward managers leadership course with 24 people already going through and 75 further places. And we've also got 9 members of staff who are on the regional leadership programs. So there's a huge amount going on. Now for the latest statistics on safety and on infection control. Unfortunately, in December we had 1 case of C. diff, which took us over our annual limit of 25. We had no cases of MRSA, and I'm delighted to say that a case of MRSA from May 2013, originally attributed to the hospital, has now been classified as community. So that means we've had 0 MRSA for the whole year. There were 2 cases of E. coli, and the latest HSMR data, which is for October, is a fantastic figure of 83, bringing our year's average to 88.5. Here's the C. diff chart, which I've updated into January, so you can see that there have been 2 further cases. But the good news is that the orange line, which is this year's performance, is now below the green line, which is last year's performance. So we continue to improve year on year. And here's the data for mortality, and you can see here 6 yellow dots in a row at or below 100. So we're doing really well on HSMR. So the serious harms in month are just the 3 cases of infection, because we've had no never events, no pressure ulcers, no serious falls, no ventilator required pneumonia, and no central line infections. So that's a very excellent low number of 3 serious harms in month. Moving on to our measures of effectiveness, and of course the most famous one at the moment is A&E performance. Now, December, Christmas and New Year, we had a fantastic A&E performance, and we were one of the best in the country. So congratulations to everybody involved. But filming this at the end of January, I can't fail to mention the difficult and sustained period of pressure we've had in unscheduled care throughout the month, which has unfortunately meant, as you can see from this latest graph, that we've been knocked off our top spot for A&E, temporarily at least, by Bolton. But I'm confident that we'll get that back in February and March. Financially, December was quite a good month, and the cumulative position for the Trust so far is that we're £500,000 in the red. This is because of the continued pattern where we're above budget for income, but also above budget for expenditure, and our CIP has now slipped £700,000 from where we want to be. However, capital expenditure is very good at £13.5 million to date, and our overall financial risk rating of 3 is quite satisfactory, and we are forecasting a 3 million surplus for the end of the year. Now some service and site updates. The IVF clinic, which is going to be starting building at Wrightington, is due to start in May with completion in November. We're doing the groundworks in preparation for the business plan for Wrightington Phase 1, should that be passed. And also the Wigan office development is intended to start in July this year with completion by May next year. And finally, as a general update, attached to your payslips, you'll find some information about some modifications to the way incremental systems work under Agenda for Change. On Healthier Together, it's now looking more likely than ever that there will be some sort of public consultation in June, and it will be a public consultation on some options that we really don't approve of as an organisation. As we get closer to the time, we will certainly be giving staff a great deal more information. But what I'm pleased to say is that we continue to have very solid support from our partners in the CCG and our partners in the Council, who really want to preserve the excellent hospital services that we currently have for the people of Wigan. The main external measure of caring is the friends and family test. And the really good news is that we're getting fantastic results in this, doing much better than most of the other organisations in Greater Manchester. The less good news is that we're not getting the volumes that we need to score highly. So please do encourage patients to fill in and return those cards. Now, we launched Always events in January, and that's gone down extremely well internally with staff. And what we want to do next is to ask what the impact has been on patients. So you'll see a number of audits taking place over the next few months, seeing what the patient experience has been like. And one interesting piece of feedback that we've had already is that one of the Always events that staff find difficult is the one about challenging people where you see things that aren't right. So Pauline Law is going to be putting out some guidance to help you if you're in that situation. Now, from deep midwinter, early warning of something that's going to be a great event in midsummer. We've got the NHS Triathlon again, something that we did really well in last year. And the good news is that we've got 15 funded teams for the event this year, which takes place on the 29th of June. So if you're interested in running, cycling and swimming, please contact Emma Cook, and it'll be first come, first served to get into this team. Finally, many congratulations to Megan Shuttleworth, who is the Employee of the Month. Megan is a midwife, and she has been an excellent all-round contributor to the team, but in particular, she's been going out speaking to students about the importance of a career as a midwife. So congratulations to Megan. And that's the end of the team brief part of January's podcast. So here I am with Mike Watson, one of the most familiar faces in the Trust because he's worked here for 31 years and he's actually worked for the NHS for 41 years. So I'm going to ask him some questions about the Hanover Building. So Mike, first of all, what are the main functions that go into this building?
This building accommodates three main departments. We have the endoscopy department on the top floor, the Richmond urology department on the middle floor, the women's healthcare department on the ground floor. In addition, we have an endoscope reprocessing unit which cleans all the scopes within this facility.
And what are you most proud of about the reconstruction that took place here?
The thing I'm most proud of is the involvement of all staff. We had a great involvement from the medical team and the nursing staff and all the estates and facilities. They really worked well together to produce the end result, which is this striking building that we now have. The building itself opened in summer 2013 and is now very much a landmark within the Leigh locality. In addition, we've just recently been recognised for the design of the building by winning the Building Better Healthcare Award for 2013 for the best use of retained estate, and that was against very stiff NHS competition across the whole country.
I understand that you had one or two problems during construction. What were they?
Surprisingly, for a building of this size and complexity, there weren't very many problems, but the two that do stick in my memory are, first of all, one weekend, two patients climbed onto the external scaffold of the building, refused to move, and the police had to be called to talk them down. The second thing that was fairly interesting was that a project team member broke into the building outside normal working hours to view the progress on his department.
Really? Goodness me, that's unusual. So tell me, have you got any good news stories about the Hanover Building?
The official opening of this building by popular local MP Andy Burnham on the 24th of January was well received by both staff and patients. Mr Burnham toured all the departments, had a keen interest in learning the activities and happily posed for many photographs with staff. The event itself was very successful, and the follow-on event in the afternoon where we opened the building to staff was also well received.
And is there anything else you'd like to mention?
As the project manager for this complex development, I'd like to express my appreciation to colleagues that worked with me on this. They are namely members of the design team, the project team and the commissioning team, because without their help and support, we would not have the successful end result that we now have.
And finally, the three quiz questions. So first of all, we do decontamination of endoscopes in this building. How many a week do we do?
On an average basis, approximately 150 per week.
And secondly, the outside of the building has won much acclaim because of the new fascia that's been put onto it. How many individual panels are there?
There are 761 in 3 colours.
And finally, the question I know everybody wants to know the answer to. Who is it that works in this building that did a caesarean section on a cow whilst on holiday?
That has to be Mr. Sean Burns, who is our clinical lead in the women's healthcare unit.